Dear ladies and gentlemen, we are about to start. We are waiting just for 30 seconds for our guests. I would like to say in advance that this side event will be recorded and we received consent from all our high-level speakers. If co-sponsoring countries or other delegations would like to take the floor, they will be more than welcome. And if you have some questions, please put them to chat, and we will try to answer them upon the time availability. Excellencies, colleagues, ladies and gentlemen, the COVID-19 pandemic and its dramatic impact on the world drug problem are at the core of this year's CND agenda. Following up the special statement of the Commission, which has been unanimously adopted today at the opening of its 64th session, we would like to discuss international, regional, and national dimensions of this challenge, share good practices and lessons learned, and consolidate our efforts in mitigating its consequences while addressing and countering the world drug problem. I would like to thank everyone who has joined us today. A broad participation of co-sponsoring countries, international and regional organizations shows our solidarity and determination to tackle this challenge together. With this, I would like to give the floor to the Russian Deputy Minister of Foreign Affairs, Mr. Oleg Seromolotov, for his opening video statement.
Уважаемая госпожа исполнительный директор УВАЛИ, уважаемые дамы и господа, благодарим за присоединение к российской инициативе и вашем участии в нынешнем специальном мероприятии. Пандемия коронавируса стала центральной и наиболее актуальной темой в повестке дня мирового сообщества. Убеждены, что наша комиссия, вслед за главными органами системы ООН, призвана дать решительный ответ на этот трансграничный вызов, который в значительной степени меняет глобальный нарколандшафт. Тем самым КНС также несет свой вклад в работу политического форума высокого уровня по устойчивому развитию. Широкая представленность государств, профильных международных и региональных организаций на данном мероприятии свидетельствует о нашей солидарности перед лицом ковидного вызова в контексте решения мировой проблемы наркотиков. Точкой отсчета на этом пути являются 3 антинаркотические конвенции ООН. Важно, что эти международно-правовые акты нацелены не только на борьбу с наркокриминалом, но и на обеспечение должного уровня доступности наркотических субстанций в медицинских целях. Эта задача приобретает особую актуальность в период пандемии, которая нарушила функционирование цепочек поставок соответствующих медикаментов нуждающимся странам. Связанные с пандемией тенденции по-разному сказались в различных странах и регионах. Вместе с тем есть и общие проявления, такие как активное использование наркоторговцами теневого сегмента интернета для сбыта наркотиков, рост потребления психоактивных веществ вследствие депрессии и социальной изоляции, возросшая нагрузка на системы общественного здравоохранения. В рамках нашего мероприятия мы хотели бы проанализировать эти тенденции, обменяться наработанным опытом и наилучшими практиками. Убеждены, что возникшие чрезвычайные обстоятельства не должны служить поводом для ослабления наших усилий на пути решения мировой проблемы наркотиков и борьбы с ней, как это переподтверждено в Министерской декларации 2019 года. В плане преодоления долгосрочных последствий пандемии следует отметить возрастающую роль профилактики наркомании, особенно среди детей и молодежи. Надеемся, что эта тема получит полноценное освещение в ходе проводимого на полях сессии при донорской поддержке России молодежного антинаркотического форума. COVID-19 поражает не только человеческий организм, но и экономику целых стран и регионов. В этой связи необходимо активизировать наши усилия в области альтернативного развития, обеспечить устойчивость программ по замене наркокультивации легальным источниками дохода, чтобы помочь людям не впасть в нужду и отчаяния и одновременно предотвратить их попадание в сети наркобизнеса. Усилия государств должны сопровождаться синергией с гражданским обществом, волонтерским движением. Пандемия коронавируса наглядно показала, насколько человечество нуждается в помощи волонтеров. Буквально по всему миру люди помогали врачам, которые боролись за жизнь пациентов, пенсионерам и согражданам с ограниченными возможностями. В России борьба с пандемией сплотила миллионы неравнодушных людей. Только за прошедший год в различных добровольческих проектах приняли участие более 15 миллионов россиян. Планируем максимально использовать этот задел и в дальнейшем. В заключение хотелось бы высказать глубочайшую признательность разработчикам вакцины от коронавируса, которая, как мы надеемся, позволит нам вскоре вернуться к привычному образу жизни и очному режиму работы. Рассчитываем на ваш коллективный обмен мнениями, позволит выработать эффективный ответ и на глобальную наркотическую пандемию. На этом позвольте мне предоставить слово исполнительному директору УНП госпоже Вали, которая является для нас ключевым партнером по антинаркотическим направлениям. Спасибо за внимание.
Dear colleagues, we are very sorry for this technical problem, and this is one of the challenges posed by the pandemic, but which is not in the mandate of our commission. So we hope that the main points of the statement were on the screen, and Mr. Saramolotov mentioned in his statement the unique role of the UNODC and its initiatives, such as the Youth Initiative and Alternative Development Projects in COVID and post-COVID times. With this, it's my honor to give the floor to Her Excellency Ms. Kada Vali, Executive Director of the UNODC, to present the office's findings and approaches to the pandemic and its repercussions on our joint efforts to address and counter the world drug problem. Ms. Vali, the floor is yours.
Thank you, Anna. And the speech was very clear. The subtitles in English were very clear. So thank you. Excellencies, distinguished participants, ladies and gentlemen, it's an honor to join you for this virtual side event. My thanks to the Russian Federation for organizing this timely discussion, which follows on today's adoption of a C&D statement on the impact of the pandemic on the implementation of member states' commitments to address and counter the world drug problem. COVID-19 has changed our world, causing immense tragedy and loss of life. The global pandemic has also shifted drug markets, patterns of use, and trafficking trends, further threatening health, safety, security, and development. It will take collective concerted efforts by all member states to address these challenges effectively. As the C&D statement acknowledges, the pandemic, by putting health system under severe strain, has also had a negative impact on drug treatment and health service capacities. According to a rapid assessment conducted by WHO, at least one intervention or service related to drug use was partially or completely disrupted in 65% of countries. Furthermore, countries have faced difficulties with ensuring access to and availability of internationally controlled substances for pain relief and other medical and scientific purposes. Illicit drug use patterns have also shifted as virus-related restrictions limited social and recreational activities, which in turn reduced the use of drugs such as MDMA, LSD, and cocaine. At the same time, many countries have observed an increase in the use of cannabis and the non-medical use of pharmaceutical drugs such as benzodiazepines. Broadly speaking, illicit drug markets have proved largely resilient even in the unprecedented conditions brought about by the global pandemic. UNODC research has found that after suffering initial disruptions early on in the crisis, organized crime groups adjusted their operations with agility and speed. By the end of last year, drug trafficking appeared to be continuing in line with the pre-pandemic trends or even at an increased pace. The pandemic also served to accelerate existing market developments. Trafficking of drugs online and through use of maritime and waterway routes were on the rise, and these trends were further reinforced as the crisis restricted movements as well as overland and air travel. Moreover, in 2020, the average size of intercepted shipments further increased and several record seizures were made during the pandemic. For example, in November last year, more than 11 tons of cocaine were seized from one container at a European port. To respond to these developments, UNODC has tailored support to member states since the start of the pandemic. We issued a research brief on the impact of COVID-19 on the global drug supply chain last May, and our office has continued to deliver technical assistance to promote evidence-based demand reduction and treatment, while helping to strengthen law enforcement responses, including to tackle cyber, as well as maritime crime and drug trafficking on the high sea. Work has continued on the coca and opium cultivation surveys. We published our flagship report, Drug Report, last June, and we currently engaged in producing the 2021 report, which will also address the pandemic's effect on drug trafficking, production, and use. We continue to monitor drug market dynamics, thanks also to the efforts of many member states that respond to our call for up-to-date information on the impact of COVID on the drug problem. This research remains relevant and very much needed. We have not seen the end of COVID-19 crisis, and we will be dealing with its consequences for many years to come. The pandemic has reversed progress in reducing poverty and achieving the Sustainable Development Goals. The situation has left more people vulnerable to threats of drugs and crime, and we must offer greater support to maintain and expand prevention, treatment, and other services to reach the people who need it. Organized criminal groups are sure to take advantage of social and economic fragility to expand their activities, including drug trafficking. As we have seen throughout the pandemic, criminal groups have anticipated and adapted to changing circumstances and exploited opportunities. Our efforts to counter drug threats and address challenges must also adapt and innovate. In this context, I very much welcome today's discussion, which brings together distinguished experts from all regions. The world drug problem and the virus are shared challenges that have manifested themselves in diverse ways in different parts of the world, and this is an opportunity to discuss shared solutions. As the CND statement emphasizes, in seeking to respond to pandemic-related challenges, countries have met adversity by developing new and innovative approaches to drug prevention and treatment, as well as to related health and social services. These achievements include the expansion of telemedicine and other remote services, which represent modernization that can continue to benefit people in need, even after distancing and moving restrictions are no longer in place. We can keep building on these innovations, including by sharing best practices and further enhancing cooperation between public health and law enforcement to promote balanced, evidence-based responses. I hope this session of the CND and this special event will serve to advance these efforts and ensure that no one affected by the world drug problem is left behind. As we build forward from the pandemic, UNODC is proud to support you and is here to help you. Thank you, and I wish you fruitful discussions. Thank you. Over to you.
Thank you so much, Executive Director Ms. Wali, for this comprehensive presentation. I believe that you have covered not only the main points of the research brief, but also probably of the World Drug Report 2021. So we are looking forward to the official presentation in June, and we believe that the office has much to offer to member states in terms of strengthening their law enforcement and health systems potential to be better prepared for possible pandemics in the future. Collection of comprehensive and reliable data is another important aspect of the UNODC activities, which would help us to analyze the impact of the pandemic on the world drug problem and find innovative solutions to overcome them effectively. Now it's my pleasure to give the floor to the chair of the 64th session of the Commission, Permanent Representative of Poland to the United Nations in Vienna, Her Excellency Dominika Kroes, whose skilled leadership and guidance united the Commission in finding consolidated response to the COVID-19 pandemic and resulted in the successful adoption of the joint statement today. And I congratulate all the delegations with this huge work done. Ambassador, the floor is yours.
Thank you very much, and good afternoon, colleagues. I see many familiar faces. I hope you hear me, and I see that you hear me because you are smiling at me. Very nice. Thank you very much. Thank you also to the organizers for inviting me and for organizing this event. It's extremely timely. Unfortunately, the COVID-19 pandemic has affected the work of the Commission. I'm sitting alone or almost alone with some colleagues from the Secretariat on the podium, and the rest is somewhere virtually present. COVID pandemic impacted also the world drug problem. Illicit drug markets have been very quick in adapting to the new situation, while access to drug prevention and treatment has become even more challenging. We fortunately managed to guarantee certain business continuity, and also we reflected upon the impact which the COVID pandemic could have on the Commission. As you all know, we adopted during the opening of the general debate today a joint statement on the impact of the coronavirus disease pandemic on the implementation of the member states' joint commitments to address and counter all aspects of the world drug problem. This statement will also be submitted as a substantive contribution to the high-level political forum under the guidance of the ECOSOC, which will focus this year on sustainable and resilient recovery from the COVID-19 pandemic that promotes the economic, social and environmental dimensions of sustainable development, building on inclusive and effective path for the achievement of the 2030 agenda in the context of the decade of action and delivery for sustainable development. In the joint statement, the Commission identified actions to take to address the impact of the pandemic, including on expanding the coverage and strengthening drug prevention and treatment systems and related health and social services, and to increase resilience to respond effectively to possible future pandemics and other emerging health threats. The actions include also developing and implementing innovative drug treatment and recovery delivery service systems, such as e-health platforms and procedures in the post-pandemic environment. The actions include also promoting viable economic alternatives to mitigate any negative economic consequences of the COVID-19 pandemic. Plus, ensuring access to and availability of controlled substances for medical and scientific purposes, which may improve responses to future urgencies and emergency medical care situations. Plus, expanding law enforcement activities targeting trafficking modalities that have emerged or grown in the context of the pandemic. Plus, strengthening bilateral, regional, and international cooperation to counter drug traffickers' exploitation of traditional and online trafficking methods and routes during the pandemic and beyond. We also undertook to conduct research and collecting data on the impact of the pandemic on the world drug problem and to regularly inform the Commission about the made progress. And also to ensure that no one affected by the world drug problem is left behind in the health response to the COVID-19 pandemic. Those are just a few. Undoubtedly, also as a result of the COVID-19 pandemic, the role of the internet as an effective channel of distribution drugs rose, which once again indicates that while modern technology might prove useful in solving problems of the contemporary world, it also might turn against us. The COVID pandemic seriously impacts on drug services across the globe, especially when it comes to providing or maintaining the previous level of service. As a consequence of the pandemic, drug services were forced to transform the operating procedures. As with every crisis, this new situation offers an opportunity to learn important lessons for the future, to be better prepared for another epidemic if it happens. Sharing best practices among countries and regions might set a good example of how to draw on the international cooperation for a specific purpose of helping those in need. It's up to us to arrive at the right conclusions for the future in order to emerge from this pandemic better prepared for unfavorable events. We need collaboration both in the field of drug supply and demand reduction. The international community should serve as a vehicle for data collection, experience exchange, and discussion on effective methods of reducing the demand for narcotic drugs in times of pandemic and in general. In the joint statement on the COVID-19 pandemic, the Commission invited Member States and other relevant stakeholders to share through the Commission, for example, at the occasion of our thematic discussions, information on national good practices and lessons learned to improve national drug policies so that we are able to more quickly respond to a possible pandemic and other emerging threats. I'm looking forward to working with all Member States and stakeholders to ensure that we'll be back and that we will be back stronger at all levels in the months to come. I thank you very much.
Thank you, Ambassador. I would like one more time to express our gratitude for your leadership and for this very substantive document adopted by the Commission today. And we believe that this will also help to raise visibility of the CND in New York during the high-level political forum on sustainable development. We also hope that this document will become a roadmap to member states and UN entities in mitigating the consequences of the pandemic while accelerating the implementation of our joint commitments to address and counter the world drug problem. And the next opportunity for sharing our national best practices will be also in autumn during intersessional meetings of the Commission chaired by you. A very important partner mentioned in the CND statement on the COVID-19 pandemic is the International Narcotics Control Board. And I would like to give the floor to the INCB President, Cornelis de Jongery. Please, the floor is yours.
Thank you very much. Excellencies, ladies and gentlemen, I would like to thank Deputy Minister Ciro Motolov and the government of the Russian Federation for organizing this side event, and the board is very pleased to be a co-sponsor. We think it's important that we analyze the impact of the COVID-19 pandemic on the world drug problem, and we need to learn from this how to prevent and mitigate the negative effects. In our annual report for 2020, launched on March 25, we devoted a section to the impact of the COVID-19 pandemic, and we focused on two critical issues that the board and member states were facing. One, to continue ensuring availability of controlled substances for medical and scientific purposes, and secondly, the effects of the COVID pandemic on drug trafficking and the illicit drug markets. At the start of the COVID pandemic, the global supply chain of medicine has been affected by the disruption in the manufacturing of active pharmaceutical ingredients and by the disruption of global trade and transport and the logistical challenges due to border closures and travel restrictions. In addition, health systems were confronted with an increase in demand for controlled medicines necessary for the treatment of patients with COVID-19. These included controlled substances such as fentanyl and midazolam needed to provide pain relief and sedation for COVID patients in the intensive care. In the face of supply problems and greater demand, countries responded with a number of contingency measures, such as increasing stocks to provide a greater buffer, use of alternative medicines, parallel imports from other countries, and also temporary export bans, which in turn led to shortages of medicines in other countries. In April 2020, the board joined a call made in The Lancet, one of the world's leading medical journals, on the need to provide palliative care during and after the COVID-19 pandemic. And on August 14 last year, the board issued a statement together with UNODC and WHO on the importance to maintain access to internationally controlled substances during the COVID-19 pandemic. The board has recommended in its annual report that countries review their forecasts for the demand of controlled medicines and streamline all the necessary administrative and logistical requirements. The measures introduced by governments to prevent the spread of COVID-19 have also influenced the illicit drug markets. Robust data are scarce and the effects vary by country and by region, but they relate to, on one hand, the changes in the availability and the prices of drugs. There has been an impact on the law enforcement capacities, and there have been changes in the modus operandi of drug trafficking organizations. With the contraction of passenger flights, drug trafficking by air passengers decreased in 2020. The transportation of commercial goods after the initial disruption has largely bounced back, and therefore trafficking of drugs by maritime shipping or commercial air freight has likely continued at similar levels to those before the pandemic. Open web and dark web markets, social media, encrypted communication applications, and online forums seem to be playing an even bigger role in providing drugs to the users. Drug traffickers and trafficking organizations have rapidly adapted their modus operandi to the current situation. They're using online and encrypted communication channels and new transportation modes and trafficking routes. The board has intensified its online work through webinars and online discussions with authorities and stakeholders to raise awareness on the new trafficking trends, to exchange experience, and to provide practical approaches for law and regulatory enforcement focal points. This information exchange is vital for joint efforts to tackle these new challenges in drug trafficking. In this pandemic, law enforcement authorities, together with the board's GRIDS program and its secure online platforms, have further developed their efforts for the interdiction of dangerous substances. We hope to be getting somewhat closer to controlling the pandemic, and we must recognize and analyze and learn from the challenges that it has posed to the international drug control system. This is the time for enhanced cooperation in drug control under the principles of common and shared responsibility. I thank the Russian Federation for having taken the initiative for the side event, and I look forward to the discussion and to concrete proposals on how we can further our collaboration and meet these new challenges. Thank you very much.
Thank you, Mr. Jonhere, for your participation and for showing us the role of the board in these turbulent times. The treaty-mandated role of the INCB specifically in ensuring access to and availability of controlled substances for medical and scientific purposes, despite the disruption of the supply chains, has become crucial to mitigate drug-related consequences of the pandemic. And we hope that the board will continue this important work to improve the situation with availability of controlled substances. We also have taken note of new trends in drug trafficking and sophisticated methods which drug traffickers developed to adjust themselves to lockdowns. And we also believe that the information exchange between law enforcement authorities using unique INCB platforms is very important to interdict dangerous substances. Before I give the floor to the next speaker, I would like to invite you to put your questions in the chat so that we could save our time at the end of discussion and try to have a kind of interactive engagement. As we are well aware, different countries and regions of the world have faced various challenges and witnessed different trends during the COVID-19 pandemic. The next speaker on my list is Mr. Vladimir Norov, the Secretary General of the Shanghai Cooperation Organization, who will share experience of this organization uniting 8 countries and almost half of the world's population. Mr. Norov, the floor is yours.
Thank you. Dear Mrs. Gwadawali, distinguished colleagues, ladies and gentlemen, I would like to express my gratitude to the Russian Federation for inviting me and organizing the side event on the influence of the COVID-19 pandemic on the world drug problem. The forced widespread introduction of the strict quarantine measures and restriction led to growing contactless sales of illicit substances through the darknet, postal and courier shipments, and increasing drug abuse, which pose a serious threat to the international and regional security and stability, undermining the social welfare and sustainable economic development of states. This year, we will celebrate the 20th anniversary of the Shanghai Cooperation Organization. It has approached this remarkable date as one of the leading and responsible multilateral structures in Eurasia engaged in the fight against illicit drug trafficking. The updated working plan on implementation of the ASEO anti-drug strategy until 2023, which will be adopted in our coming summit of ASEO in September, will focus on strengthening joint efforts in preventing the use of electronic payment system and cryptocurrencies in drug-related offenses. We are going to pay particular attention to harmonization of national legal and practical measures on regulation and control of virtual currencies and movement of non-cash assets earlier to combat laundering of drug proceeds and the financing of terrorism and organized crime. The temporary cross-border traffic restriction caused a great concentration of the narcotics industry within domestic markets and the emergence of new types of psychoactive substances. In this regard, we deem it important to exchange on annual basis data on amendments in the list of controlled substances, as well as information on identified methods of drug synthesis and chemicals used for this purpose, including those not under state control. In addition, during the ASEO Moscow summit in November last year, the heads of state called for further implementation of joint effective measures to eliminate drug trafficking through Central, Southeast, and South Asia in the context of the complex drug problem in neighboring Afghanistan. To that end, we are committed to streamlining our capacity to respond to emerging risks by the regular conduct of the ASEO International Anti-Drug Operation Pautina. In view of the apparent increase in drug smuggling along water routes, we believe it necessary to pay greater attention to international cooperation in combating illicit drug trafficking by sea. We look forward to the UNODC expert and technical assistance in this area. Given the negative impact of the pandemic on people's mental health resulted in growing consumption of psychoactive substances and non-medical use of pharmaceuticals drugs, it is strongly required to promote regular exchange of experiences in the treatment and rehabilitation of patients affected to new psychoactive substances, advanced training for healthcare professionals, prevention of drug abuse, and promotion of a healthy lifestyle through mass media and relevant programs, both at the national and international level. Dear colleagues, I would like to assure you that the ASEO is open to stepping up cooperation with all international organizations concerned, including our colleagues from the European Union and ASEAN, to establish a reliable collective bulwark against the global drug threat. I would also like to take this opportunity to thank Mr. de Joch and the Secretariat of the International Narcotics Control Board for their full cooperation in the current work on the draft of Memorandum of Understanding between our organizations. Thank you for your attention. Thank you.
Thank you, Mr. Norov, for presenting us this regional perspective of law enforcement cooperation within the Shanghai Cooperation Organization, and also your ideas and proposals how to strengthen resilience of the region to drug-related challenges in times of COVID-19 pandemic, and also bringing specific examples of this cooperation, such as Operation Pautina and expert meetings on darknet and cryptocurrencies. I think this would be also a good opportunity for other regional organizations to find some areas of possible future cooperation. And now I would like to give the floor to the Executive Director of the Inter-American Drug Abuse Control Commission, Mr. Adam Nam, with his video statement.
Greetings from Washington, D.C. My name is Adam Nam, and I am the Executive Secretary of the Inter-American Drug Abuse Control Commission, known by its Spanish language acronym, CICAD. As many of you know, CICAD is the consultative and advisory body of the Organization of American States, or OAS, on the drug issue. It serves as a forum for OAS member states to discuss and find solutions to the world drug problem and provides them technical assistance to increase their capacity to address the drug problem. Thanks to the permanent observer mission of Russia to the OAS for inviting me to provide remarks at this side event. I'm sorry I can't be with you live, but CCAD is hosting its side event right now. The coronavirus pandemic has highlighted the need to adopt and promote public policies that protect individuals' health, safety, and human rights. In this regard, OAS member states approved a new hemispheric drug strategy and corresponding plan of action last December in Bogota, Colombia. This strategy seeks to position OAS member states to adapt to new realities, including those emerging as a result of global crises, such as the pandemic. Most countries have implemented measures such as stay-at-home orders that can have a profound effect on pre-existing mental health conditions and disorders related to psychoactive substance use. These measures present challenges to those who have or have had a substance use disorder, such as the risk of relapse due to difficulties accessing mental health care and treatment services. Greatly limited drug prevention programs are another unfortunate result of the pandemic. Adapting CCAD's demand reduction programming, we have offered numerous online trainings on treatment and prevention, webinars on issues such as telephone helplines, and conducted online surveys, including a survey on psychoactive substance use patterns during the pandemic. CCAD's Demand Reduction Experts Group developed and disseminated hemispheric recommendations regarding COVID-19's impact on the treatment of substance use disorders. The Pan American Health Organization collaborated with CCAD in drafting this important document. Alternatives to incarceration for minor drug offenses has been a feature of CCAD's programming for the past dozen years. Sentencing minor offenders to treatment rather than prison is a more humane approach with proven better long-term outcomes. These measures can also save money given the high cost of incarceration. In addition, prison overcrowding in many countries means alternatives to incarceration make even more sense because the coronavirus can be easily transmitted in overcrowded prisons. Regarding drug supply, the illicit production and manufacture of drugs in the Western Hemisphere has fallen since the start of the pandemic. This is due to the shortage of raw materials and chemical precursors in production centers and clandestine laboratories, which is hampering the manufacture of substances such as cocaine, methamphetamine, and fentanyl. Organized crime, though, has quickly adapted, seeking and finding ways to continue to produce illicit drugs without depending on chemical substances brought in from other regions of the world. An example is the local manufacture of chemical precursors. As a result, counter-drug agencies will need more support to prevent the diversion of chemical precursors and dismantle clandestine laboratories. Maritime narco-trafficking remains the primary mode of transportation of illicit drugs, both via commercial shipping vessels as well as in submersible and semi-submersible vessels. During the pandemic, drug trafficking by air has shifted somewhat from commercial flights to small private planes due to the reduction in commercial flights. Also, there has been an increase in the sale of drugs on social media and in crypto markets, with many illicit drugs mailed to buyers. The pandemic is having a serious impact on counter-drug agencies in the Americas for a variety of reasons, including a reduction in personnel because a high percentage of those normally working in counter-narcotics have been deployed to other pandemic-related tasks that are not directly connected to countering drug trafficking. Because of the necessity to transition from on-site to online activities, CCAD adapted the delivery of most of its programming through webinars, virtual sessions, and online courses. A positive byproduct of this adaptation is that we can reach many more via virtual activities than we could in person. CCAT enjoys ongoing collaboration with strategic allies, such as UNODC and other international organizations, as well as with permanent observer states of the OAS and civil society. Strengthening international cooperation is more vital than ever, as organizations and countries must work together even more closely to respond to challenges posed by the drug problem. Thank you, and I wish you all the best.
We would like to thank the Executive Director of the Inter-American Drug Abuse Control Commission for his video presentation, which confirms that the influence of the COVID-19 pandemic on different regions is multifaceted, and there are many aspects to be analyzed in a thorough way. And now it's my honor to give the floor to the Director of the European Monitoring Center for Drugs and Drug Addiction, Mr. Alexis Gustil. And I would like to say from my side that EMCDDA arranged a fantastic series of expert consultations last year and is one of pioneer regional entities to examine the consequences of pandemic. I'm sure that this experience will also help member states to adjust their national policies to such challenges. Mr. Gustil, the floor is yours.
Thank you very much. Can you hear me? Yes. First, I would like to thank the Federation of Russia for the kind invitation and for the initiative to organize this side event on the impact of COVID-19. In the few minutes that I have, I will share with you some of the main findings that we can present on the impact of the COVID pandemic. And first of all, what I would like to say is to say a few words about the impact of the pandemic itself and what is more broadly the situation in terms of drug market and drug use and harms in times of COVID. So the first is that during the start of the pandemic, in the first weeks and months, as far as the impact on treatment and harm reduction availability is concerned, there was a very severe disruption of services all over the European Union, especially because most of the treatment centers or harm reduction services have been closed. There was therefore reduced availability of services. Also, they were not considered as being essential, and therefore there has been a difficulty because the professionals working in those programs had no access to protective equipment against the virus. So certainly the first impact was in terms of disruption. But after the first few weeks, and also taking into account that the measures for the lockdown were not exactly the same in all the EU member states, what we also can say is that there have been very innovative solutions that have been found by the people working in the treatment centers or in harm reduction to maintain the link with their clients and to remain helpful. And I would say also in many cases to adapt themselves to the new needs and new urgent needs of their clients. So this means we have seen a lot of innovative solutions. For instance, in cases where the rules for screening of the patients and first assessment of the candidates before to enter in OSTs, those rules were not applicable because of COVID and because of the lockdown. At local level, in most of the cases, solutions have been found to find alternatives to make the assessment of some of those patients and to allow them to enter in the OST program even in times of lockdown and of COVID pandemic, which is very important because we have seen that in many member states, there is a certain proportion, relatively small, but still a proportion of people who are using opioids in particular, who in facing a shortage of heroin or shortage of the drug at local level, they decide to try to enter in a opioid substitution program. So this has been an example of improvement. In other cases, for instance, it was necessary to avoid any concentration of patients in the centers, and therefore, as the director of a treatment program in Italy said in Bergamo, he said that he uses the expression that they needed to make or to conclude gentleman agreement with the client. For instance, giving them methadone doses for 3 or 4 days in advance, of course, for patients who were stabilized in the treatment, in order to maintain the treatment and to reduce the risk related to COVID. The fact that this has been the opportunity to see clients and users as partners, and not only as the socially deviant population as they are sometimes seen, has been key for maintaining the efficiency and the added value of those programs. A second impact that was more mixed is the impact of the pandemic on patterns of drug use. There have been temporarily shortages, of course, in the first weeks of the lockdown. Less drug use in social settings, which means that MDMA, for instance, or cocaine in the first stage, there was a reduction of the use. But for instance, we have not noticed any critical change in the patterns of consumption of amphetamines or methamphetamines. But then there has been also increase of some other substance use, mainly for cannabis, but also alcohol, and then medicines, in particular benzodiazepines. And here what we detect through the early warning system on new psychoactive substance of the European Union, it's also an increase in the apparition of the European market, not only of existing benzodiazepines, but in some cases of fake benzodiazepines. Or another group that is growing in importance are the new benzodiazepines that are not yet used in principle for treatment, but that are molecules that are existing and that are appearing now on the market. Then the third impact on COVID was that it has shown that the organized crime groups are very resilient and very innovative, and that the digital transformation for organized crime was also boosted by the epidemic, pushing towards another and much more important dimension, the activities not only on the internet but on the darknet, and of course showing the importance of, for instance, the services of encrypted messages, as we see with the Sky operation that was recently launched in the European Union, to dismantle a very important network that was relying on the services of Sky software and messaging program. If we look at the drug market, if we try to characterize the situation today, what we say is that there was no huge impact of the pandemic on drug trafficking at wholesale level. Drugs availability remains high in Europe by all standards. We are facing a never seen before availability of any kind of drugs, being of synthetic or vegetal origin. We also see a very high purity or potency of those drugs. Just to remind you that the potency of THC in the cannabis has doubled in the last 10 years, and an impact on drug use and the economy. The second element, second characteristic of the drug market, and my colleague and friend Adam Nam was just describing this for the Americas, is the increased role of large shipments, and also that leads to the infiltration of logistical supply chains. And the preliminary data we have about drug trafficking in the European Union and the drug seizures of last year show that there is no indication whatsoever of a reduction in drug trafficking in that period. What we also see is the diversification of production. We observe first examples where it is bringing manufacturing closer from consumer market, from synthetic drugs to heroin, cocaine and cannabis. And also we see the growing influence as far as the production of methamphetamine is concerned, the apparition on the European market of organized crime group of Mexican origin being involved in the development of production facilities with the capacity for industrial level production. Finally, what are the drug use and arms characteristics for the moment? What we see overall is an increased use of cocaine and crack cocaine. And crack cocaine is extremely worrying in the sense that it was almost anecdotal consumption in the EU 10 years ago, only in a few cities. And also, it is characterized by the fact that people who are using crack cocaine are not entering very quickly into treatment. So basically, the importance of the problem is still partly under the radar. And this is why our cooperation with production services as far as data collection is also very important. What we also see is that the increase in the potency of THC, but also the increase in the admissions to treatment for problem cannabis use. And there have been a lot of issues. One of the most recent issues appearing regarding cannabis.
Désolé, je n'ai pas bien entendu ce que vous avez dit.
One of the major problems related to cannabis is the new products. You probably know that in some of the countries or states where recreational cannabis was made legal, we have seen the apparition of new edibles or new products, including products for vaping. Last year, in the first quarter, for the first time, we have seen through the early warning system, we have detected one of those e-liquids, as they are called, being detected in one of the Scandinavian countries. I would just like to mention one figure for that, is that those e-liquid, they can contain up to 95% of purity of THC, which means that it transforms them in the kind of a little THC bomb, which means that the potential risk for the population are very important. And there are some indications that there is a growing apparition of these kind of products, at least in some of the EU member states. Second characteristic regarding drug use and harms is the growing importance of synthetic drugs and new psychoactive substances, new opioids, and here it seems to have a small shift with a bit less availability of fentanyls that we may associate or link with strengthened measures of control at EU level as part of the legislation on NPS and the early warning system, but also some of the control measures that have been put in place by China on those substances. Also new benzos. Still, we have one new psychoactive substance appearing on the European market every week, and we are monitoring more than 830 new substances that have appeared on the European market in the last 20 years. And then finally, I think it's important to highlight the importance of the health consequences, namely hepatitis C. And despite the fact that there is now a treatment that is available, still, if we want to reach the Millennium Goals, we need to address better and the group of the people who are consuming drugs that are a very important group as far as hepatitis C is concerned. Drug-related deaths, but also new uses, new substances, and new risks. And to conclude, what I would like to say is that we are facing a situation where we could be in front of a potential future perfect storm with highest ever availability of all kinds of drugs, higher potency and stable or lower prices, at least in real terms. At the same time, we see already the economic crisis that has been caused by, as a consequence of the COVID-19 and the measures that had to be taken to protect the population. We see there is an indication of some increased entry in criminal drug-related activities of young people. So certainly we cannot consider that drugs are not a problem anymore. They are just different from before, but they are everywhere and they are much more present than before. And also they show that what has been a key element for maintaining successfully programs during the pandemic was a better association, dialogue, trusting the clients of the programs. And in that sense, the harm reduction and treatment centers have been part and have to be considered as part of the essential service. So we need more comprehensive and more inclusive approach. And certainly we cannot develop those approach if we don't associate and include as partners the beneficiaries from those treatment. And I would say in a situation where the worst can still happen, I think it's time to use the motto, do the right thing. Don't forget about drugs. Don't focus only on COVID because you may miss the next pandemic. Thank you very much.
Thank you, Alexis. I believe that COVID-19 pandemic has posed challenges, but also provided opportunities for member states to develop innovative approaches. And it was quite clear from your statement that health professionals managed to adjust themselves quickly, and that many innovative approaches may also be used in the future, but there is much work to be done, and we need to continue sharing national and regional best practices, and surely it's impossible to do it within this limited time. But we hope this is a first step, and that Commission will be a right venue to continue these important deliberations and discussions in autumn, and that EMCDDA will also continue to arrange expert consultations on post-COVID measures. With this, I would like to thank our high-level speakers for their multifaceted presentations and their engagement in the side event, and also co-sponsoring countries. I would like to ask whether there is any delegation among co-sponsoring countries, or probably another one who would like to take the floor. We don't have much time. We have so many negotiations and events in parallel, but please don't hesitate to take the floor for your remarks. And please indicate it in the chat if you would like to take the floor. So it doesn't seem to be the case, but we hope to continue this discussion very soon, and we hope that our side event has inspired member states and regional organizations to strengthen cooperation on these important matters, and to accelerate implementation of our commitments on addressing and countering the world drug problem, and we are looking forward to further discussions. Thank you so much for joining us today, and we wish you a successful session of the Commission. Thank you.